everyone. My name is William Wu and I'm a PGY1 Family Medicine resident at Queen's University at the Belleville-Quinte site. I'm originally from Ottawa, Ontario, and I went to medical school at Queen's as well. So why rural medicine? I was initially attracted to rural medicine for the diversity of experience. I was someone who really enjoyed all of the different rotations of medical school, and I found when I did rural medicine, I could do all of those things and more. I could be a family doctor, I could be an emerge doc, I could deliver babies if I wanted to, I could work in the hospital list. And so I think that scope of practice was the biggest thing that drew me to rural medicine. When I actually got to my first community, which was Perth, Ontario, which is a small town of 7,000 people in just outside of Ottawa, the other thing that really attracted me to it was I found that there was this really strong sense of community and a very tight-knit group of colleagues as well. If something happened in the emerge, I would hear about it in the clinic. That kind of small community and that collegiality was something that I really liked. I liked working with a small group of people, I liked working with a small community of patients, and I liked having the ability to adapt my own skills to the needs of my community as well. So at Belleville-Quinte, we are a pretty small community site affiliated with Queen's University, and so we welcome 6 new PGY1s each year for a grand total of 12 residents, 6 PGY1s and 6 PGY2s. So one thing that I love about the Belleville-Quinte site is the way that we learn family medicine. We have a totally longitudinal curriculum, which means that we spend about 2 to 3 days per week back at our home base, our family medicine clinic. And we spend our entire first year with the same preceptor and our entire second year with the same preceptor. So you really get to know your preceptor and also the patients that your preceptor has. On your first day of clinic, you'll show up and you'll see maybe 6 to 8 patients. And then you'll roster them, and they'll be the first 6 to 8 patients that you'll have in your little mini roster. And the beauty and the joy of doing that is that you very quickly start feeling like you are the main doctor for these patients. When you see them once, you send them for investigations, the blood work that they need, and then you're the one who's going to be following up on those things. So you're going to be getting the inbox messages, you're going to be the one who's booking them in afterwards and chatting to them about their A1Cs and about their x-rays and figuring out a treatment plan for them. So very quickly you take on a lot of ownership of your patients, and overall it's great because it kind of trains you from day one in the way that you might practice in the future as a family doc. I alluded to this one before, but my favorite thing about family medicine is the flexibility. I think that as a family doctor, you can be anything that you really want to be. You can be someone who is a family doctor, you can be an emerge doc, you can be a hospitalist, you can be someone who delivers babies, you can be someone who takes care of kids, who does addictions, who does palliative care, you can be a dermatologist. And so I think that's the beauty of family medicine, is that you have the flexibility to be as broad scope as you want or as specialized as you want. And it's all of the same basic training and any additional training that you want to do. And being able to have that flexibility to adapt to the needs of the people around you, of the colleagues that you work with, is really special. And I think it's something that keeps you really engaged in the specialty for a very long time and keeps you engaged in lifelong learning. As cliche as that might sound, it really is. It truly is very fun to be in a specialty where you're constantly improving yourself, and the improvements that you make to yourself as a doctor can directly impact patient care and help the community that you're a part of. So I do engage in some research work outside of my normal clinical duties as a resident. Right now I'm working on a project, or thinking about kind of putting it together with one of my co-residents, a project about POCUS, our POCUS curriculum at Belleville. POCUS stands for Point of Care Ultrasound, and it's something that is kind of new to family medicine, but can be very applicable. And so the way that we train POCUS at our site is that we follow a train-the-trainer model, which essentially means that we have a couple senior residents each year train 2 of the PGY1s each year. And then once the PGY1s are trained up, they train the next couple of PGY1s. And then once those PGY1s are trained up, they train the next couple. And so we kind of longitudinally, step by step, kind of train everyone. And so you get the experience of learning how to do POCUS and also of teaching how to do POCUS. So our project is looking into whether that's a good model or not, and if it can be a solution to some of the barriers facing incorporation of point-of-care ultrasound into family medicine curriculums around the country. So one thing that I love to do during my free time is to play sports. I've always loved playing sports ever since I was a kid. I love being part of a team. And I feel like I've been really fortunate here in Belleville to find a community where we have an awesome community sports league called All Sorts of Sports, where we essentially play a different sport each week. And a bunch of co-residents of mine are on the team, and every Wednesday night we play basketball, we play dodgeball, we play floor hockey, and it's just a great time. It's a great way to chat and hang out and catch up. And do something that's not medicine related. It can get pretty competitive sometimes, but it's all in good fun. So really lucky to have that as part of my wellness plan. This one's a bit of a tough one. I have no idea where I'm going to end up practicing in the future. Probably somewhere in Ontario because my family is here. But I do know I want to work somewhere rural. I want to do a little bit of remote low-coming as well. So maybe back to Moose Factory for a few years, which is a small Northern Ontario community up by James Bay that I spent some time in as a medical student. Maybe back to Perth, which is close to my hometown of Ottawa. But I'm really not sure. Well, I think my plan is to do a bit of low-coming and see where I fit in terms of the community and the vibe and the colleagues. And go from there. All right, here we are at our last question. So a couple tips that I would have for any medical student who is interested in rural medicine is, number one, just get yourself out there. See if you can find yourself a rural placement somewhere. See if you can do an integrated clerkship. Those integrated clerkships are really helpful because they give you enough time to establish yourself into the community and to put down those roots. And also gives you enough time to develop relationships with your preceptors and your patients, which is a part of rural medicine that's hard to understand until you actually experience it for yourself. My second tip would be to make the most out of your opportunities when you're there, to try to actively seek out learning opportunities. I think one of the incredible things about being a learner in a small town is that you're often the only learner there. And so everything that goes on in that town is an opportunity for you to learn from. So if you're someone who's interested in family medicine and you want to become better at diabetes, see if you can set up a half day with the diabetes coordinator and learn about the new technologies and glucometers. Or if you're someone who's interested in acute care, see if you can, pick up some more emerge shifts, or even better, leave your name at the emergency department and see if people can call you in if there's a trauma or if there's a big resus that comes in. That's how I learned about intra-abdominal penetrating wounds. It's how I saw my first stab patients when I was working up in Moose Factory. So I think the point is that in rural medicine, there's so many opportunities to learn. If you so choose to actively seek them out. It can really be a very enriching and incredible experience if you kind of just look for those opportunities. So those are my tips for any medical students who are interested in joining rural medicine. And if you have any questions at all, please feel free to reach out to me at any point. And best of luck on all of your medical journeys.